Namaskar, I am Dr. Shivkari Gandhi from Dr. Gandhi's Ayurveda. Today we are going to discuss a very common gynecological problem, PCOD, also known as PCOS. It is so common endocrinopathy that it seems like every other urban female in the reproductive age has it. So what is this disease? Why does it happen? And is it really treatable? Let's understand. PCOD happens when arm or toxins mix with the blood due to bad digestion. The blood, being connective tissue, is a vehicle that carries oxygen and nutrient throughout the body. However, due to toxins or arm being mixed with it, ovaries are getting affected. The body is extremely intelligent. It tries to prevent anything from harming the eggs laying inside the ovaries. In order to not to be infertile and in an attempt to reduce these toxins reaching the eggs, it forms an insulating layer on the ovaries, which is called cyst. PCOD is nothing but a defense mechanism of the body to prevent toxins from harming your reproductive health. However, due to that defense mechanism, it comes with its fair share of problems. And symptoms occurs like insulin resistance, acne, irregular periods, excessive hair growth, trouble in conceiving, and many more. A simple pelvic sonography and blood hormone test can reveal whether you are suffering from PCOD or not. In Ayurveda, it can be treated with dietary modification, minor lifestyle changes, and medicines. Furthermore, Panchakarma therapies like Virichin, Basti, Nasya, and regular practices of therapeutic yoga and pranayama go a long way in helping patients treat PCOD kind of complicated cases. Certain herbs like Kanchnar, which helps control cyst, Shatavari and Ashwagandha helps in balancing hormones and brings periods on time. Methi, Neem, Karela, etc. kind of bitter herbs, we can use it for reducing insulin resistance. And Manjishta improves chances to conceive. There is so much more that can be done to help and treat PCOD and PCOS patient without the need of injecting or orally taking hormones. For any more information you would like about this subject or any other disease or Ayurveda in general, all you have to do is like, subscribe and press the button so you know instantly when our videos are live. This is Dr. Shivkari Gandhi. Namaskar.